Hi, I'm Doug Mayer, Dentsply Midwest trainer and product specialist. Handpiece sterilization has been a hot topic my entire 24-year handpiece career. So I wanted to give you some handpiece sterilization history as well as some recent news and some information. In the late 1980s, 6 patients of Dr. David Aker, a Florida dentist, discovered they had contracted HIV. One of those patients, a young woman by the name of Kimberly Bergalis, became sort of a spokesperson regarding this HIV outbreak, likely to have been contracted during a dental visit to her healthcare provider. Kimberly appeared on the cover of People magazine and even testified before Congress regarding her condition and the need for disease prevention. This led to many news stories, culminating in the May 1992 airing of programs by NBC Dateline and CBS Street Stories regarding the specific lack of handpiece sterilization in dental practices. Everyone seemed to begin sterilizing high speeds the next day, which was mostly due to patient questions and demands. 1 year later, in May of 1993, the U.S. Centers for Disease Control updated their 1986 recommended infection control practices for dentistry to include the routine sterilization of all handpiece components that are used intraorally. As scientific information poured in, the CDC once again updated their recommendations in 2003. This time recommending, quote, clean and heat sterilized handpieces and other intraoral devices that can be removed from the air and water lines of a dental unit between patients. And further stating, although dental handpieces are considered a semi-critical item, they should always be heat sterilized between uses and not high-level disinfected. This statement logically included low-speed motors. However, much controversy arose as to whether the CDC was actually suggesting sterilizing low-speed motors between patients. This led to several scientific studies to determine if, in fact, low-speed motors became contaminated during use. The conclusion of these studies determined that low-speed motors do, in fact, become contaminated inside during use and urged that low-speed motors be sterilized between patient uses. Which brings us to the most current event in handpiece infection prevention. In March of 2016, the CDC published their document entitled Summary of Infection Prevention Practices in Dental Settings, Basic Expectations for Safe Care. This document is meant to make it easier for dental healthcare settings to know exactly what to do or not to do. Think of it as kind of a Cliff Notes version of the 2003 recommendations, but putting all of this information in one place and making it easier to understand and to follow. And so, as to clear up any confusion regarding handpiece sterilization, the CDC makes this specific note, quote, dental handpieces and associated attachments, including low-speed motors and reusable prophy angles, should always be heat sterilized between patients and not high-level or surface disinfected. While these devices are considered semi-critical, studies have shown that their internal surfaces can become contaminated with patient material during use. If these devices are not properly cleaned and heat sterilized, the next patient may be exposed to potentially infectious materials. That's pretty clear, so I'll just let that sink in for a moment. And then, of course, the next question. Doug, do we have to do that? Isn't it just a recommendation? How am I held accountable to recommendations? They're just recommendations. Well, in a nutshell, a license holder is held accountable to the CDC guidelines by their licensing body, which are the various state dental boards throughout the country. Therefore, not following the CDC guidelines can be considered unprofessional conduct in most states. This is pretty consistent since in 1992 there was an actual federal law which required each state's public health official to certify to the Secretary of Health and Human Services of the U.S. government that guidelines issued by the CDC be instituted in their states. And those few states that do differ slightly in their rules from the CDC guidelines are busy updating those rules to comply with the CDC recommendations today. But another question that seems to come up just as often and just as quickly, it's not really that big of a deal, is it? I mean, nobody really gets sick in a dental office, right? Well, here are a few headlines to consider. CDC studies show hepatitis C kills more Americans than any other infectious disease. A Yale University study reveals hepatitis C virus proven infectious for 6 weeks on surfaces. And a JADA October 2013 study, a study looking into hepatitis B virus transmission associated with a portable dental clinic in West Virginia in 2009, with one highlight of this study specifically stating that handpieces were only wiped down and not heat sterilize between patients. So what is the moral of this story? Be very familiar with the CDC guidelines regarding proper sterilization techniques, as well as what to sterilize and how. Be alert for items that tend to get overlooked in an office but need to be sterilized between patients. In particular today is the low-speed hygiene motor and the operative air or electric low-speed motors. I hope this short talk reassures you on the importance of handpiece sterilization and infection prevention. Thank you for your time, and let's make patients safe out there.